Good afternoon. This is 4 o'clock, May 23rd, Thursday, 2019, Board of Health meeting. Just to remind everybody out there that this meeting is being recorded by video and audio. And before we get started, we do have a new board member, Rita Higgins from the Select Board, but she may be a little late.
She's in the executive session for the Select Board right now.
Yeah. Is there anything that's not on the agenda out there that anybody would like to talk about? Seeing nothing, we'll move on. Roberto's director's report.
Yes. So just 4 quick updates. We're working on printing out and getting more tick information out. Dr. McNabb mentioned to me yesterday that the Steamship Authority doesn't have tick information out yet, so we'll print some of that out and get that to them. Ticks have been active for a few months now due to the mild winter. So we're trying to get as much, now that it's picking up, trying to get as much information out as possible. Get out ahead of the outbreaks, the bites.
Have something?
Yes, ma'am. Sorry?
Does Thailand have something?
I'll check with them. They should still have what we gave them last year, but we'll confirm. And then I'll see if we can get some things out at the airport as well. We're currently advertising for a new inspector. We're expanding by one. As of today, we have 5 applicants in. We got 2 more in this morning. But the application period closes next week.
Are they local people?
Only one so far is local.
And where would we house?
That's the question. So the one of them that's local already has housing, the one that's local, but the other 4, one of them alluded to having family on the island, a family house. But hopefully, we'll see how many applicants we get by the end of next week. As you'll see in the newspaper today, a letter was issued last week about illegal and substandard housing being offered by restaurants, food establishments in general. We issued that letter based on 2 complaints. They came in surprisingly early already, and then today we received yet another one, so we'll be inspecting tomorrow. Basically what the letter is saying that there is a provision in the food code that all housing situations and all living situations need to be outside of the food establishment, the permitted establishment. That's part of the federal food code. And then also in the state food code, it says that their permits are contingent upon their compliance of all local and state regulations and laws. So what we said was, if they're providing this illegal or substandard housing, their permit to operate can also be tied to this. So we've received a surprisingly positive response to that letter. We're receiving murmurings from during inspections, or people walking in or sending emails saying, thank you, we're trying to do things right, but other people are not. So it's a step in the right direction. So it's going well.
Has the health department made any decision what they're going to do for a first-time offender?
The first-time offender gets a fine under the housing code. So as soon as you put a bed into a location, it becomes a dwelling and no longer any other type of establishment. So we can fine them under a housing code, and that's $500 a day per violation. So for as long as the violation exists. So the first step is definitely a fine with the warning, and another copy of the letter, or a separate letter. And then by the second violation, we'll bring them here for a suspension hearing. And if at the 3rd violation, we can downright revoke the permit. So
how does that go through the Board of Health, or does that have to come to the Health Department?
Board of Health.
Board of Health.
The Board of Health are the only ones who are allowed to revoke a permit. Okay. So they would come here with the suspension hearing. You can suspend a permit for as much as 2 minutes, to as little as 2 minutes, to as much as 2 years. It's up to the board on what they deem fair. And then lastly, we're moving forward with the water laboratory conversations. We received a estimate on what the costing will be right now. Very preliminary numbers are coming in at around half of what we expected it to be. Some actually closer to 1/3 of what we expected it to be. It's definitely less than $1 million. So in conversations with some of the nonprofit groups on the island, some of the work might actually be able to get funded without town money, but we're working on getting that information. The things the town would cover would be the employee itself, the 2 employees themselves, and the benefits. But everything else might be covered independently. And so that's really good news. And the consultant we're using to design the laboratory will be presenting at the Shellfish Association's annual meeting on June 23rd, I believe it is. Yes. So let me confirm. Sorry.
Probably
June 24th
Admiralty's Club.
at the
Nantucket.
Admiralty's Club on June 24th.
Do you remember, what's his name?
His name is Dr. Michael Delaney. He was the laboratory director for the Massachusetts Water Resources Authority, MWRA.
Yeah.
So, and he sits on the federal EPA board on laboratory design and safety. And that's it. Those are the 4 updates. There you go.
Review of the minutes. Any additions, corrections? Anybody know?
No, I'm good.
In a motion to?
Actually, there are.
Oh, there are.
I had Jim Kelly down, if you'll read them, up
Oh.
in the header and everything, had Jim Kelly's name, and I need to replace those with Rita's.
No, I didn't notice that.
Well, at the last meeting, neither Rita or Jim were here.
We'll just, then at least make it blank.
Yeah.
I don't think she was
I
a,
think I have her,
Yeah.
put her down as
She didn't sit.
Yeah,
she
she wasn't.
wasn't officially a member.
Yeah, she hadn't been appointed
Kelly
yet.
is missing, or
Yeah.
neither of them were.
Yeah, Jim Kelly would have been the one I was missing because Rita hadn't been officially appointed yet.
So I thought by then he was already off.
Yeah, I did too.
Yeah.
No.
Yes, that's correct. Rita had Christie had already been elected.
Basically, his seat was a vacant.
Was vacant. Yes, his seat was vacant.
At least we moved Jim.
Yes.
I approve the minutes be approved as with the
Amended.
suggested corrections.
Second.
All in favor?
Aye.
Aye.
Okay.
Cannabis advisory.
So at the last town meeting, Robert Cole put in a request for a cannabis advisory committee that was referred to the administration, and they're creating this advisory committee. However, in the charter, it's requesting that 1 member of the BOH be on there in case of any sort of health-related issues that come across. The Cannabis Advisory Committee is not a committee to talk about the product itself and the laboratory testing, things like that, more so along general policies on how to do some of the youth prevention, how to do things about the craft growers process, issues like that. The health issues will always be a Board of Health and Board of Selectmen jurisdiction.
So did they set policy?
They advise policy. They do not have a charter to set policy.
So the committee could advise health policy,
Correct.
like labeling and so forth.
Correct. Correct. So we just need to appoint a member. If she's Rita's not here.
I wouldn't mind taking the position, but I think you should wait till see if I'm reappointed to the board.
We can table it to
Do
the
we,
next.
can we table it to the?
Because
Definitely
the
table it.
appointments will be made the Wednesday before our next meeting.
So we can table it to the next.
So if
Board of
I'm
Health
still
meeting.
here, I'd be
Yeah.
glad to take that assignment.
Sounds
If
good.
not,
Thanks.
Yeah.
it's yours.
Thanks. So we'll table that till next meeting. Composting facility letter.
Yes. So every few years, the landfill has to renew their permit for the composting facility and the digester. And one of the issues that we always run into with it. It's not an issue. It's just a formality from the state. Is they need to make sure that the local board of health is okay with them providing distribution of the compost that comes out of the composter. So the compost pile that you see out front that people can grab to fertilize their lawns, fertilize their garden beds, things like that, that actually has to have an approval letter from the State Department of Environmental Protection. What they're looking from us is just a letter of either no objection or approval, so that they can continue to do that. I drafted a letter, which I was able to email out yesterday, and I have a copy of it here in case we need to sign it. But if there's any suggestions, I don't think there should, it's not really an issue. We've been doing this for years now.
Do we inspect it now and then, or does someone actually see that it is?
So Rob has actually taken the reins pretty well here, and they do send off samples for testing. CDM Smith does the testing.
Yeah, I think that, and then the state puts their approval on it, I think, yeah.
Yep, the state, it has to meet a specific parameters of purity. It cannot have any sort of pathogens in it. So they are required to test it, but Rob has really been going above and beyond the testing, and they're actually about to start a PFAS testing protocol, the polyfluoroalkyl substances, which is an emerging contaminant of concern. So we'll hear back from that relatively soon. Now, when I say relatively soon, I mean using government time, which means it can be anywhere from 6 months to a year.
Right.
So I would just need a like a consensus or a.
Well, I'd like to make a motion to support the letter.
I'll second.
All in favor?
Aye.
Aye.
So. All right.
Okay, variance request 123, Wall Winnett. You're gonna recuse yourself, okay.
So I'll let Art introduce this one. Yeah. I think both microphones work. Just make sure you introduce yourself.
Good afternoon, Ryan Maxwell with Rocket Engineering. I apologize, I'm a little under the weather if I sound funny. So this variance request was in front of the board a couple months ago for the installation of a tight tank. Excuse me. The existing system is in hydraulic failure. It doesn't have the required groundwater separation. So we were proposing the installation of a tight tank. At the time, the board asked us to look into installing a conventional system on the lot. So we sat down with Jeff Carlson from Conservation, we sat down with Art, and worked with the homeowners to look at some options. And what we determined is a conventional system is technically possible on this property, but it would require substantial variances from the Conservation Commission, given the sensitive nature of the property. The system would need to be mounded. We'd have to install a pump chamber and potentially some sort of IA component to comply with the regulations. So in looking at all those variables, we're back to the tight tank being the logical choice. So just one thing to consider if you look at, do you guys have copies of the plan?
Yeah, I mean, I have this, yeah, I have it in front of me. It's not,
Okay,
yeah.
so one thing that we are gonna do is we're doing away with the addition on the back of the residence. So this would just be a standard upgrade of a failed system. And with that, I'd be happy to answer any questions.
I mean, I think, you know, we've talked about this with Art and stuff, and I know because it has to be, it is a tough area there, and it would have to be mounded. Then you have to reclimate that area that you mound for drainage, which would actually cause more damage,
Right.
or in the dune, right?
Right.
Right. And one of the other things I just noticed on the plan is you have is it a 4-bedroom house?
That's what we have it listed as, yeah.
But then in the letter here with going to sign to the property as a seasonal house, you listed as, in the wording here, as 2-bedroom.
Yeah, I think, I don't know why I think it is a 2-bedroom home. I'd have to look at the property. I'll have to look at the septic application that was installed in '93, and we can rectify his application for the tight tank could then be sized to whatever is existing.
Right, I was just saying, in this, I mean, if this is a like legal document, it's one, they're contradicting the bedrooms.
Yeah, I can't tell, I don't know, and all I can tell you is they would be allowed to put back what they have.
Right, yeah.
And when we determine that, when they make the application, that piece of it can get corrected at that.
Okay, yeah, because I think the original,
I don't have the answer, and I don't think Ryan does.
yeah, probably the original permit was for, that was in the ground was 4,
Yeah,
right? I'm getting,
and all I'd like to add to it is that if it wasn't for the coastal flood zone, you know, we probably, the recommendation would be different, but it is such a sensitive area, and the displacement and the work they have to do in that area, it just does seem like it, you know, it's best to go with a tight tank. So, you know, our job is to protect natural resources, groundwater, dunes, wetlands, and it seems like it is the responsible thing to do, even though a conventional system could be installed there. It doesn't seem like it is the right thing to do.
any questions?
No, I see no problem. I would support a tight tank request, providing 2 and 4 is sorted out.
So,
204 and no new construction.
and no new
No
construction. Can I just ask, Ryan, I mean,
Yep.
architect, the placement, you placing the, as a pump guy here,
Not
the
in a
tank is in the,
spot.
is in the back, and I was just, you know, I see George has a contract here, but I was just, for the sake of the easement, I mean, the easiness of servicing the tight tank, is it possible to put it down front, or is there problems?
Yeah, the front of the lot is a lot lower.
Yeah.
In elevation, it's at elevation 6 or 7, and the back is 8 to 9. So to get the proper cover over the tank and all that, it's easy.
I mean, I know you deal, going down lower, you definitely probably hit groundwater at like
Right.
1.5 feet, but.
Yeah, this tank is going to be in groundwater as it is.
Yeah, I was just asking because it's a little bit of a hike around the back, but I get it. So I could get a motion.
So
to-
I move that we approve the application for a tight tank with no new construction, and that the health department sort out the correct roomage.
Second.
All in favor?
Aye.
Aye.
That's the correct what?
Room, number of rooms.
Number
Roomage.
of rooms, room count,
Room count.
bedroom count,
Thank you.
just for the sake of that. Just for the sake of signing this event, you know, the seasonal thing. Right. Okay, 15 Wall Winnett.
If you'd like
And
to,
I
yes.
will, I'm going to actually recuse myself because I annually work with Tom and MJ for them, and
Sounds good.
turn it over to Malcolm. Well, I know it, yes.
Either microphone. Yeah. No, you can go ahead and go. Listen.
So just, Roberto, you want to summarize first, and then we'll hear from the applicants?
Yes. Oh, actually, let's have Art. Yeah, Art
Or Art
do
can
it.
summarize
Yeah.
for us. This is a
Request for an extension. Yeah, to extend the permit.
Okay,
Yeah, so this one's a difficult one.
thank you.
We have a system that's been failed since 2008. An inspection was done in 2008. The homeowner was notified in '08. They were notified in 2016 that the system was failed and needed to be repaired. In 2017, they were notified. 2018, they were notified as well as cited. They did get a permit in January. Because of the extensive length of failure here, we wanted this to be corrected sooner rather than later, so we put a 6-month expiration date on the septic permit, which is June 14th. So the applicant's asking for an extension of that permit. So the health department is recommending an extension to September 30th because they do have a contractor who is agreed to do it, I think, on the 27th of September. So there's a few day leeway there. And we recommend that there'd be an $850 application fee, and that if it's not done at that point, I mean, there has to be a penalty for this many.
Right. Well, you said they were cited at one point?
Yes.
And
In 18.
Last year.
And that's what spurred the permit. So anyway, we believe they're going to do the right thing here.
Right.
They've made some ground in a good faith effort, and one more chance. We would, reluctantly, we don't want to grant an extension. We think it should be done right now, but it's not. And, we're hoping that it will be. And this would be, the opportunity to get it done.
and the penalty if they did not get it by September?
I don't know any other way but to start condemnation proceedings.
Okay.
There's no other alternative besides that and possibly daily fining. That is where we are.
Okay.
May I respond?
Yes, please.
Yes, I want to thank the Board of Health for hearing us today, and my wife MJ has been with Arthur and Toscana and much closer to this than I am. I just want to state that we've tried to be very considerate. We've lived in this house since the mid-1980s, 85, and we've been very considerate about maintaining what we could as far as the septic. Steve's father put a state-of-the-art system in, and we've done everything we could to keep it clean, and I thank you for the moment. MJ will fill you in on the details. Thank you in advance.
First of all, we don't want to take up too much of your time. What has happened over the years is that many people in our area had condemned septic systems. We are not, I don't think, the last ones in the area to have ours addressed. But meanwhile, I did speak with the Board of Health a few years ago when we met in the conference room at the town building, whenever that was, to explain what our situation is on our property. And we said that we would do the right thing, of course, and Art Gasparo is somebody who's familiar with our property. We wanted him to do the work because we needed somebody who knows where we live and what the issues are. Art could not do our project immediately. He put us on the list, and as soon as he was able to get to it, he designed a septic system for us, and we applied for a permit. We had also asked Toscana to do the work because they've done work for us in the past, and they also are familiar with our property. They said that they probably couldn't get to it till next year. And then Bernie came back and said that he could do it by the end of September, and that basically he felt that his word, he stands on his word, and the town would accept the fact that he's going to have it done by the end of September. Therefore, it came as a surprise to us when we asked if we could extend the permit until Toscana could do the work, that you would penalize us, because in this sense, I'm not exactly sure what the penalty proves. We've acted in good faith. We have asked all of what we feel are the best people to work on our property, to do the work. They have done the work. we're not pushy. We don't call people and say, you need to do this, you need to do it right now. We actually wait our turn. So this is when everyone could get to it. The system we have has not failed in the sense that it still works. We don't pollute the harbor. As far as we know, we don't use pesticides, all of that. So I guess I question why asking us to pay a penalty for work we intend to do that we've paid thus far to do, what that proves. I don't think it's quite as, what should I say, a dramatic situation. We plan on doing the new septic system. We have the design, it's been approved. We're waiting for Toscana.
Comments from the board or questions?
I have a couple of questions. The 3 or 4 times that you were cited for not having it done, had you planned to have it done? Did you have drawings done? Did you?
Of course, we plan to have it done, and
No,
we
I mean,
had
did you
talked to
physically talk to people and try to set a date to have the system fixed?
Art. Yes, of course.
You did.
Yes.
Well, what I'm saying
But
is,
I didn't know we had to tell the town. I guess I don't usually deal with the town on many issues, and I didn't know that if we were doing what we needed to do. I was in China teaching in 2015 and 16. Therefore, that time I was not paying attention. I wasn't here. And then, of course, when we got back and we started the process. And that's why I called the health department to say we were doing this, and then I came in and met with Art, and we discussed some of the issues on upgrading, and here we are. But we plan to do the work. We were never intending not to do the work, and it's expensive.
okay. I have one other question. Now, if we get to September the 30th, and for some unforeseen reason, it isn't done, who do we blame? Do we blame Toscana?
Sure, because they said they'll do the work as soon as they can.
But where does that leave us? Because the system still won't be taken care of, so.
Well, of course it's going to be taken care of. There isn't a question of it's not being done.
But what I'm saying to you is, if we give you a date, if we
Yes.
give you an extension till September the 30th, that means it's got to be completed and inspected by September the 30th. And my question to you is, if something happens and Toscana can't get there to do the thing,
Okay.
what happens at September the 30th? You have to have another extension.
What do you suggest?
I guess what we're getting at.
Well, I just,
Yeah, there's some. We're obviously uncomfortable because this has been in failure for such a long period of time. We're probably going to get to an extension, but it's sort of in our DNA that we really don't like to do that because we like to be pretty strict with the septic systems in this island.
We're already talking about a 4-month extension from June until September.
Yes,
So that's,
but it's been going on for
I know.
years, so that's why we're a little unhappy.
That's fine. Is it something that Toscana can put in writing and we can submit to you that they have told us that they will do it? And you already have it, you have it in writing. Well, we've worked with Toscana for several years. We rely on their quality of work, and we expect that if they say in the past that they will do something, that they will. That's been our experience in the past, and we expect it to be in the future. That's what we're planning on.
I understand that, and probably it will be done. I'm just looking at the option that if Toscana gets behind, all I'm saying to you is, if the permit's good till September the 30th and it isn't done, then what do? Extend the permit again?
I don't think we.
I mean, we're putting a due date for September the 30th. So by September the 30th, someone's going to go out and inspect that system and expect to have it done.
The,
If
no,
it isn't, where do we stand?
the normal process would be that at that point, we would file a complaint in court.
But,
I
okay,
apologize for your complaint to the,
Courts.
thank you.
Okay.
okay. Well,
Okay. Okay. Well, uncomfortable situation. Should have been dealt with a long time ago, but I get the sense, as Art said, I mean, it's got to get done.
I would like to have a copy of that thing from Toscana saying that they will have it done by September 30th. A copy
Yeah,
of that
there's,
given to the health
it's,
department.
it's in the file. Yeah.
It's in the file? Okay.
Okay.
Thank you.
Any other questions?
There was a recommendation of a fee in the recommendation, so we would need a vote on that as well.
Well, I think that the $850 fine, it basically fee is because they've been lax in doing the thing over so many years. I think that's basically,
It's just we would need a motion on either way, for or against it.
right.
That's the only thing.
The program has just had theirs.
If I can add one thing.
Please.
Once again, I don't know how this plays into the overall picture, but we have been very considerate to be sure that it is maintained. Steve has been very considerate and taken care of us, at least on an annual basis, and we have tried everything we can to maintain that system. Once again, at the time, it was a state-of-the-art system, and there are people in our community right in the neighborhood who are just getting their permits completed and having their septics changed. We go ahead. Sorry.
Excuse me, no, our neighbors just finished. There are many people in Pulpus that are just getting to it now. So we are not at all alone in this.
Right, so
And our system isn't failed, it just doesn't meet the new requirements that were changed after our system was put in.
I have no emotion about a fee. I just want this done.
Well, the health department is the one that put the fee on there, so,
Is this the recommendation of the department?
That was, yes.
$850.
Correct, which is a re-permitting fee.
It's re-permitting fee. That's fine.
Yeah, because it's the cost of the permit.
Yeah, that's fine then. It's really the cost of the permit.
Yeah.
It's cost of their time too.
right.
So I would, we need a motion to impose the $850 fee and a motion for or against the extension of the permit to June 30th.
I make a motion that we leave the fee where it is, and I also make a motion that we accept the letter from Toscana saying it'll be done on the 30th and approve everything.
So
I'll second
is
that.
that to grant the extension?
Okay, so the motion essentially is for imposing the $850 fee. The extension will go till June 30th.
September 30th.
Wait a minute, I'm sorry, I have hearing loss. You want us to pay the fee because you think that's gonna get us to do the work faster?
No, it's a re-permit.
No,
fee.
the $850 fee is because we've spent a significant amount of time tracking the system, just contacting you, contacting others.
Yeah.
So the $850 is the cost of a permit fee, is really what it is.
We already applied, but Art already explained that some of that permit fee are things that you're not asking us to submit. You've already approved the plan, it was supposed to be like $500 and something dollars.
Which Art? Art Casparo or Art Tell? Yes, that was Art Casparo's request. A request that,
Why are you, in other words, this is a fine, it's not paying for a new permit.
it's, what we're asking you is to pay for the whole permit fee again, because it has to go through an entire new process.
And as I stated, we are acting in good faith. Why is the fine?
So the fact that it's here at the Board of Health is because it was technically failed since 2008. A technical failure is a failure, regardless of the way that you want to define it. The state defined the technical failure as a septic system failure, so we failed it approximately 11 years ago. You've had 11 years to put the septic system in. $850 is actually a very minimal fee. We could charge $850 per permit application period, which is a 2-year time, which is $850 times 5.
Yeah, so
We are being very lenient with $850.
yeah, we don't have to go to that. I think that's the motion, and that's the motion. Any further that's the motion. Any further discussion? All in favor?
Aye.
Chairman votes aye. So there will be an $800.50 fee, re-permitting fee essentially, and you have until September 30th.
Correct.
Thank you, gentlemen, for hearing us, and we'll move on with due diligence.
Sir, thank you.
Thank you.
And then, no, we'll just bring it to us by the September 30th.
Okay, moving on. 12 Creek Lane.
So the 12 Creek Lane, I think it's also a Don Bracken application, so I'll let you introduce it.
Ryan Maxwell, Bracken Engineering again. 12 Creek Lane is a vacant lot in the Fisher's Landing open space development. The lot is almost 23,000 square feet. The variance request is to allow for more than 110 gallons per 10,000 square feet of lot area, which is a requirement in the Nantucket Harbor watershed. We had a little mistake on our request letter that we sent to you. It indicated that we were requesting essentially to build a 3-bedroom dwelling when in fact it needs to be a 4-bedroom dwelling. So I have revised letters if the board wants them. I'll
Sure.
hand them out.
Yeah.
It's gonna look just like the other one. except for a couple numbers.
Do this one for the record. Thank you.
So the board granted a similar variance on the abutting lot in 2015, and we're basically just asking for the same consideration.
All right, I do believe the existing lots, not in 15, but maybe a couple years ago, we granted the half-acre lots 4 bedrooms and the 10,000 square foot lots 3.
It was in 2015.
Was it? Well, time flies.
Under Paul Santos, NSI came in, and that's what it was. 4 bedrooms on 20,000 square feet with IA.
With IA.
And 3 bedrooms on 10,000 square feet with IA.
On those existing vacant lots.
On the existing vacant.
So it was 4 on 20 and
3 on 10.
3 on 10.
3 on 10 with an IA. That's what we've done before.
Yeah.
And that's what you propose,
We
right.
were gonna install that.
Yeah.
It just needs it always needs that.
Right.
Because it's an official variance.
Well, I don't see it. I'd like to get a motion to approve.
I'll make a motion to approve the requested variance.
I'll second.
All in favor? Aye. Thanks.
Thank you.
Any comments from the board? I always forget to put that for the second to last is
the
comments
second,
from the board. I always forget to put that as a agenda item.
We're not shy.
Anything? I mean, did we, on the landfill in the estuaries saying, was that put off till next meeting? Do you remember?
Yes.
Yeah.
The for the Nantucket regulation.
yeah.
that's to the next
We're waiting
meeting.
for the report.
Yes, because we're still waiting from the SMAS report.
I feel like every meeting
It's-
we ask this question.
It's the most ridiculous ping pong match with SMAS to the point that we, I don't mind saying it in a public meeting, we've kind of lost faith in their ability to meet any sort of deadline. It definitely makes me never want to work with SMAS. from the health department perspective. I would rather work with hundreds of other consultants.
Would it take a letter from this board to?
They received letters from this board,
Yeah.
the Board of Selectmen, the Nantucket Residents Association. They work when they want to work. So it's to the point that we have to hope that they deign to give us the presence and give us a report before,
The day before the board.
which will probably be,
And that's not, then we can't do anything.
yeah.
So if we change people, do we have to start all over?
Too late.
Yeah. I don't know if I'd go
It'd be
down
another
that.
year if
Yeah.
we change people.
Basically, we lose credibility.
That's the issue. Well, we've definitely lost. We haven't lost the credibility, but SMAS definitely has,
Well, the town
We're
loses
associated,
credibility,
and the town ends up
and we lose credit.
taking a hit for that. It goes back to the same reasons as to why people were against the Nantucket sewers in the first place.
I mean, this is, yeah, it's credibility. I mean, there's a budget estimate half of what it was before. We don't have the data.
Yeah,
I mean, this is
it is one of the. It is in the 4 years that I've been here now, 4 years. This has been one of the most frustrating consultants I've ever worked with, because they don't respond. They don't provide good estimates. They don't like explaining their process. And because it's a proprietary algorithm, the state is beholden to them. So they jerk people around.
okay.
We're trying to get it in as soon as possible. We email them at least once a week.
Yeah.
If we change companies, do we get all the information that we've paid them for so far to give to us?
We get everything we've already paid for. The problem is we won't be ever using the same model. They have a proprietary model. And it's the only,
Not that anybody else can. These other companies.
Yeah,
can't
we
do
would-
it. It's just that he did it for all the estuaries
Yeah.
on the southeast coast.
the whole issue is that SMAST has a proprietary model that has been peer reviewed by the National Academy of Science and Medicine. And they have reviewed it, endorsed it, so they've now been using that model, that estuaries model, as the gold standard in estuaries predictions all up and down the eastern seaboard. In order to use a different consultant on it, they would have to develop a new model, which would be extremely expensive. So as a result, the SMAS consultants that we work with, when they decide to not respond or, for lack of a better way, throw a tantrum, we have to just wait it out because they're holding us.
Do they give us any idea when it's gonna be done, when it's gonna be ready, when they're gonna answer what we need to know?
They claimed that they hit delays, so they're now telling us early to mid-June, which, as we know, means the day of or the day before the Board of Health meeting. So
Okay.
the Board of Health meeting right now is scheduled for June 20th. I'll be in Baltimore for my last set of classes. Art can run that meeting, or we can push it back to June 27th. It is up to the board.
What about moving this particular topic to July? There'll be more summer residents here, but
There will definitely be more summer residents, but the way the regulation is written is it'll come into effect on July 1st.
We have to deal with it by July 1st.
Yeah.
Yeah, and I know Art has.
Not that I don't wanna run that meeting, because it doesn't bother me, but I'm wondering if one more week,
Yeah,
if it gives you all, if we get the information, gives you all time to analyze it in that time. I have no problems with doing, it's just a thought.
Yeah.
So that, it would be the,
27th.
Thursday, June 27th.
June.
Yeah, right there.
It's up to the board.
So what if we don't get the information when they think we're gonna, when you think you're gonna get it?
Then we're stuck with making the decision on June 27th of whether we want to push back the regulation and let the regulation go in force. The regulation in Nantucket mirrors the regulation in the Great Harbor watershed. So starting July 1st, any of those property transfers that happen will require an IA upgrade.
Well, like we discussed at the last meeting, that I brought that point up. The people from Nantucket, we hear,
Mhm.
we didn't have our stuff ready, so we can't blame them. So
Exactly.
if it happens again, we can't force them to do something if we don't have our.
No.
That's the decision we have to make on that day.
Can we extend?
But how many times can we keep putting this thing off? We can't just keep doing it.
It's what we were just saying. It's a credibility issue. That's the weight that we have to carry here. And I would be happy to forward these minutes or even this video to SMAST and tell them that they are now affecting entire policy decisions for an entire county of the state of Massachusetts.
Yeah, I mean, it gets to a point where enough is enough.
Even if we got a week before, you know, this is a major decisions have to be made. I really want to look at it. I want to read the fine print. I want to look at the statistics. I want to look at the number of samples. I don't know.
Is there anybody you can file a complaint with? Another department or something in the state that,
Technically, they answer to the University of Massachusetts at Dartmouth.
All right, well,
It's,
Right, but I think, you know,
we can,
Brian was the head of the whole estuaries project with Brian House.
yeah.
so
So
if we put
And
off the
Brian
meeting
House is the one
for-
who's not responding.
I know, I know, but maybe we could talk to Dudley and say,
It's worth the
maybe,
shot.
I need to call him.
Yeah, it's worth a shot. Yeah, we can talk to Brian Dudley. Have them light some sort of a fire under their feet, because they've even received letters from town council, and they just
All right, well, I guess the decision here is we put off a week.
We move the meeting till the 27th.
okay, June 27th.
I mean, I'm fine with that, yeah.
I would let them know. I mean, that's an excuse to delay.
Yeah.
Maybe, can we hold off the decision on changing the meeting date? It's a public hearing.
Well, we can always re-advertise it. That's not too much of an issue.
You, the June date, the July 1 date
Is firm.
That regulation kicks in.
Yeah, it's
so
not,
Regardless,
I
it's
will not support going to the 27th. That's
too close.
that's too close. And if we don't have the report or we're not happy with making a decision, we can say we can extend the deadline a month, which is not great, but
yeah.
I just don't want to be sitting here on July 27th with 3 days going, the Nantucket Association up there.
It's right here.
The press over there and trying to understand it all.
To extend the,
September 1.
Yeah.
to the,
We could extend it to September 1.
if we do that, do we have to do that at a public hearing, or?
It would be at a public hearing. So right now, the public hearing is already scheduled for 6:20.
Okay, right,
So we can make our decisions at, I would just leave it
Leave it at 6:20.
yeah.
Okay.
at 20 is,
Thursday, June 20th.
June.
yeah.
Keep it under Thursday, June 20th. Okay. And then,
That gives us time before the deadline to make a decision of what to do, whether we're going to extend it to the September or
not.
not.
Okay. And we
We'll
will,
open the public hearing and say, listen, we've only had this for 3 days, so we're going to extend it to September.
and we'll get back into contact with Brian Howes and we'll try to contact Brian Dudley.
Yeah,
So,
okay, thanks. Any other comments and nothing on your
No, I mean,
mind?
it's just, you know, it doesn't seem fair to the people in Nantucket either,
it's not.
you know?
No, but I think they'd want to They want that, they want to see that too, that
No, I'm sure they do, but
it's important. Yeah.
Sounds good.
Okay, hear a motion to adjourn.
I make a motion.
Second.
All in favor?
Yes.
Aye.
It is a